Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Tests for developmental dysplasia of the hip. In the tests, first we have asymmetrical skin crease test. So asymmetrical skin creases are present in the thigh and they are also present in the gluteal folds. Asymmetrical skin creases are seen in the thigh and in the gluteal folds. Then we have Orta-Lenny test and Barlow's test is seen. We have Orta-Lenny's test, second Barlow's test. In Orta-Lenny's test, first we will push the leg of the baby with abduction. So this in Orta-Lenny's test, this child's leg is pushed. The child's thigh is actually pushed. It is pushed and abducted. So when the child's thigh is pushed and abducted, then the chunk of clunk, a sound is heard which states that the head has entered the acetabulum. So on pushing and abduction, on push and abduction of the hip joint, you can hear the clunk of, that is the sound of entry of head into the not acetabulum, into the acetabulum, right. In Artolini's test, when we push and abduct it, the clunk of the head, when the head enters into the acetabulum, a sound is heard, which is, if it is heard, then it states that it is positive Orta-Lenny's test. Whereas in Barlow's test, we will pull and do abduction. On pulling, and if you do abduction, sorry, pulling and adduction, pulling and adduction of the hip, this will actually, on pulling and adduction of the hip, this will actually dislocate the hip. On pulling and adduction of the hip, this will dislocate the hip. So this is Barlow's test. So these both, so what is the difference? So actually Artolini's test states that the hip can be dislocatable. The hip is not yet dislocated in Artolini's test, but it can be dislocatable also. Whereas because so this is pushing anteriorly and abduction of the hip. So when we push the hip anteriorly and on abduction of the hip, the clunk of sound is heard mainly on entry of the head into the acetabulum. Okay, so this states that it is dislocatable hip, that is the hip can be dislocated. So this is actually a test for, so this Orta-Lenny's test will actually reduce the hip to the normal position. So this is done in hip which started to dislocate. When the hip has started to dislocate, in them we can do this Orta-Lenny's test. Whereas Barlow's test, here we will pull downwards and we will adduct the hip. When you pull downwards or inferiorly and if you adduct the hip, okay, this will dislocate the hip joint. So this is done in reduced hip. In reduced hip, you can do this Barlow's test, because with Barlow's test we are able to dislocate the hip. So this will state that the hip can be dislocated. Then we also have one more sign which is called as Galeazzi's or Ali's sign. This Galeazzi's test or Ali's test will tell us about the shortening only. So we have Galazi's test or Ali's test. This is mainly for shortening of the hip. So this is the Galazi's test. And here the asymmetrical thigh folds are seen. And this is one more test, which is telescoping test, which is also done.
Thank you and thank you for watching.